Folks, we are pleased to be joined by our good friend Lilo Stainton, who is healthcare writer. Check her out on NJ Spotlight News. She's a regular contributor. It's a great news operation. Check out that broadcast as well as Metro Focus for the daily situation. We're looking at the COVID situation, big picture on February 2nd. So, Lilo, let me ask you this. Last time you were with us, I said it again, moving target. This will be seen 3 weeks from now, a month from now. So while we don't know every detail, my question is this. Overall, what the heck is wrong with the vaccine distribution? Just a small question, Lilo. Can we, quote, blame it on one entity, or is it across the board?
It's complicated, right? I mean, I wish it was easier. Trust me, I wish it was easier. I hosted an event on this last week, and there was no shortage of wrath from the viewers and commentators. And I get it. I get it. The problem is, as a person in the media, you're stuck in between. You can only provide the answers that we're getting from public officials, right? So what are public officials telling us? Well, they're telling us, they're doing their best to build this system. It is, slower rollout than they would like. It's slower rollout clearly than needs. They built a new registration system. That's part of the problem.
They being, Lilo?
I'm sorry, they being the state. They being the state. And there are clearly issues with, sort of how they've done this or that and which groups they've chosen, and you can quibble with that. But there is also, you're absolutely right, there is this sort of overarching issue of, are we getting enough vaccines? And the answer to date has been no, we haven't. I mean,
as of now, as of February 2nd. So right. I'm going to push that issue. Sorry for interrupting, Lilo. If vaccine distribution, supply and distribution were multiplied by 3 or 4, meaning massive amounts, more would be available. Grammatically, I'm sure that wasn't right. Question, would that by itself dramatically improve the vaccine distribution system?
Well, it's funny that you say that, because I talked to a number of people, including someone in the supply chain process last week, and they said, the supply chain so far is going pretty well. Vaccines are getting where they need to go. We haven't heard too many issues about that. But they said, yeah, well, wait till we scale this all up multiple times. So I think there is a concern. There was a concern at the beginning about a shortage of healthcare workers to actually give the shots. You think it's so easy, but if you can't actually get the shot in someone's arm, if you don't have somebody licensed and available to do that,
But excuse me, Lilo, they knew it was coming. When I say that, here's the thing. I'm not, blaming is not only useless, it's counterproductive and frankly petty. Question, if Warp Speed was working as well as it was, and the anticipation was that it was happening, how could there be an issue with supply of healthcare workers to administer? That's not making sense to me as a layperson.
No, I agree with you. And I think there's blame on both the federal and state. So federally, we've had these shortages of healthcare workers for years, right? But the state, there's also blame on the state. They did not appear to activate their volunteer system for this until after the vaccine rollout started, as far as I can tell, or at least they didn't make a public plea for help. I mean, it seems to me that if they've been planning this, they being the state, since March, that would have been a box that was checked, especially when that was something everybody knew was going to be a problem. But, same with the registration system. You'd think they'd build a centralized system that is, more efficient. Things don't always work out as you can. But of course, if you still don't have enough vaccines coming down from the feds, it's not going to work. But the question is, even with your question is a good one, even if more come down, do we have the infrastructure to support that? And I hate to say, but time will tell. I mean, I'd like to say yes, but it's a question of how quickly it scales up, and can systems keep pace?
And by the way, check out Lilo on a regular basis on NJ Spotlight News with our anchor, Brianna Finozi, who is absolutely the best with a terrific team. The day-to-day situation will be reported there. Let me ask you this, Lilo. African-American, Latino, people. I don't want to say numbers because that's ridiculous. We're dealing with people. The percentage is way too low of the vaccines administered as of today for those who are black and brown. What's going on?
That's a question I posed to the state. I hope to have an answer for you in a day or so, and hopefully a story about it. But or what they can do. We know why it's going on. Basically, we know that there's concern in the communities about vaccines, about being guinea pigs. There's historic reason to believe that.
With the Tuskegee experiment, et cetera.
You cannot do this story without talking about Tuskegee, exactly, and that's totally legitimate. Have the systems, the state and private systems, done enough to try to reach out to them, to get Black and brown communities to make sure that there's a way that they can get easily vaccinated? That's kind of what we're trying to find out. But the numbers are disturbing. Remember, this is also a disease that impacts, I just did the math, Hispanics, 26% of the cases are Hispanic individuals, 12% are Black individuals. Hispanics make up, less than 20% of the population. So that's, there's a huge disparity there. Black folks are far more likely to die, than their white counterparts, as are Hispanics. And, there are reasons for this. There are reasons because of the jobs that they're likely to hold, because of the racism in the system, because of the housing. I mean, so much of it comes back to not just race, as someone said to me, but racism. And I think we need to be honest about that.
And by the way, a minute left. Check out our ongoing series, Confronting Racism, to talk more about structural institutional racism, particularly in healthcare. Lilo, last question. I've asked everyone, and again, it's the 2nd of February as we're taping. What is the message you believe that should be delivered on the variants connected to the vaccines? Go ahead.
Don't panic, because it makes the vaccines all the more important, but we have to remember that while they may be more virulent, and possibly even more deadly, it's the same stuff we got to do. We got to still wear the mask. We got to wash our hands. We got to social distance, and we got to stay home when we're sick. And, if I can leave people with that, unfortunately, that's what we're going to have to be doing for some time. So enjoy it, I guess, to the best of our ability.
Well said. By the way, other than checking out NJ Spotlight News every day during the week, real quick, the website for people to find out more about your writing and your colleagues with our great colleague, John Mooney, et cetera. What is it?
njspotlightnews.org now.
njspotlightnews.org.
All one. Or Google.
Hey, Leo, thank you for everything you're doing every day, you and your colleagues and the team at NJ Spotlight News. I have no idea where we'd be, which is not great already, without that team. Thank you, Lilo.
Good luck. Thank you, Steve.
I'm Steve Adubato. Stay with us. We'll be right back.